Governor Kasich is defending one of his most controversial decisions as governor, expanding Medicaid.
Ohio's director of Medicaid visited the Miami Valley discussing the benefits of Medicaid expansion.
Advocates and patients both hoping a new study builds support for Ohio's Medicaid program.
The director of Ohio's Medicaid department believes the expansion of the program is allowing people the opportunity to work.
We're finding out more about the expansion of Medicaid in Ohio. Director came to Toledo Wednesday to talk about a new study on how Medicaid is impacting adults without children.
The new expansion of Medicaid has given more people the opportunity to work.
4 years after going out on a limb to get Medicaid expansion enacted, Ohio's outgoing governor defends the program.
Governor Kasich believes his successor will keep Ohio's Medicaid expansion in place.
State officials say 1.2 million Ohioans have been able to get health insurance over the last few years because of this Medicaid expansion.
The state released a report about how many people have benefited from it.
Barbara Sears discussed a new report that shows Medicaid costs taxpayers more than $160 million a year. However, Ohioans receive about $5 billion worth of health coverage in return.
60% of these people say being on the program made it easier to find jobs, and this led to nearly 300,000 people dropping Medicaid because they were able to make more money or get a job.
Miami Valley Hospital here is one of the state's largest providers of Medicaid, and that's why Program Director Barbara Sears was in town today touting the success of Medicaid expansion. She says it's critical for quality of life for patients right here in the Miami Valley.
The governor talked up the progress of the program 4 years after he expanded it. The governor says this: 290,000 Medicaid participants unenrolled because they got a job or they started making too much money to be enrolled. 60% of unemployed enrollees reported Medicaid made it easier for them to look for work. And the governor says Medicaid also helped 26,000 people quit smoking.
Tawana Cox says within the past 4 years, Medicaid helped her afford a life-changing back surgery.
Could go back to work full-time, out of pain, without being in pain. And that was a big deal for me because I had gone through it for so long.
She's among the almost 700,000 low-income Ohioans covered since the program expanded in 2014. Monday's State Director Barbara Sears says stories like Cox's back up the results of a new report.
It's shown that Medicaid works, it's shown recovery works, and that getting people health care means that they have the ability to get back to work.
Sears says those healthier workers made healthier communities and stronger economies.
I'm able to go to the doctor and get the care that I need, and so therefore I'm able to go to work.
I'm able to work for a company that I enjoy and not have to go to someplace that's less enjoyable. I'm able to give back and I'm able to provide for my family.
Brenda Jean Searcy, a 55-year-old law student who lives with her 93-year-old father in Westerville. She says she's always been healthy, but was felt by Lyme disease and then Graves' disease. The diagnosis of the latter came after she'd signed up for Medicaid through the expansion.
This is about putting ourselves in somebody else's shoes. Think about what your life would be like if you didn't know if you could get any health care. How hard is it to say that you can get a lot of money to help a lot of people? That doesn't take any guts. It takes guts to not do it.
Kasich is one of the few Republican governors who decided to expand Medicaid several years ago. His administration says nearly 700,000 people in Ohio have health insurance right now because of it. They say this has been the state's best weapon in the fight against the opioid crisis.
During the opioid epidemic, Medicaid has been a critical asset.
Institutions such as ours are often the safety net for the community to take care of the most vulnerable.
Officials stress that they feel Medicaid expansion is manageable and affordable. With drug rebates, assessments on managed care plans, a 1% tax on premiums, and other offsets, the state's share actually drops to $163.1 million, or 3.2%.
Medicaid expansion is a significantly better deal for the states and for Ohio than the traditional program. And that's important as one considers our ability to fund this program now and into the future.
It's not only showing improvement in health care, it's getting people back to work, it's helping people through recovery, but it's a really good deal for the state of Ohio.
For $21 per person per month, that is the net state match cost to provide health care coverage to the 653,000 Ohioans who are on the Medicaid expansion.
And again, I am very grateful to have Medicaid. It has made my life much better and made me much healthier.